Welcome to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
Welcome to another episode of the Your Company Health podcast. My name is Andre Wright, and today we have a very important guest, Annalee Kruger of Care Right Inc., a company that is championing senior care living and creating a strong impact in the community. Annalee, welcome to the podcast and talk to us about who you are and the background of your business.
Yeah, so what I do, give you a little bit of background, is I used to be a social worker and admissions coordinator and executive director in long-term care communities called CCRCs, Continuing Care Retirement Communities, which you're probably familiar with since you're in the healthcare space. But those are the care continuums that have independent living all the way down to a nursing home. And every single day in 18 years of working as an employee, I had the same issue. Well, I didn't. Families had the same issue. Their loved one was in the hospital. There was a medical crisis, like mom fell, she broke her hip. Hospital says, here's a list of facilities. Go find one by noon tomorrow because we're discharging. And the adult kids were always like totally blindsided by that. So the tours would take about an hour, but I was spending 2 and 3 hours at a time with each family because they had so many questions, like what to look for, what to ask about during the tour. They had no idea the difference between Medicare and Medicaid and assisted living. And when I asked them if they had power of attorney or their parents had long-term care insurance or if their dad was a veteran getting aid and attendance, the answers were always like, I have no idea what our parents have in order. We've never talked about it. So that's what led me to leaving corporate America in 2011 and starting Care Rights Incorporated. It's actually international now, family consulting company where my team and I work with families all across the country because mom and dad and the kids don't live just down the block from each other like they used to 30 years ago when I first started. And so I went virtual right away in 2011 because, again, families live all across the country and we do aging plans. So we facilitate family meetings, find out what's working well at home, what's not working well. What are the goals? Usually it's to age in place at home, but what does that really look like and how much does that cost? We educate our families about what are the differences between Medicare and Medicaid, what is independent living versus assisted living, how do we manage dementia, how do we prevent caregiver burnout. We also do a care matrix where we do all of the market research for the different care community options wherever the clients want us to explore. So for example, if mom and dad live in Tucson, Arizona, but their 4 kids live in 4 different states, they're not going to keep flying back and forth to Arizona every time dad's in the hospital or mom falls, right? So we need to really look at, okay, what is the actual aging plan? So when mom and dad need care or future care, what does that look like and how much does that cost so that these families can make informed decisions and plan ahead? And just really educate them about the landscape of aging, the landscape of what it's going to look like, that caregiver snowball, so that they don't get burned out. And then also the cost of care and where does it make sense for mom and dad to live when the time comes that they need care. So the goal is all proactive aging planning. But the reality is that 92% of my clients come to me totally overwhelmed and burned out caregivers. They're angry, they're resentful. Caregiving has derailed their finances, their careers, their marriages, their relationships with their siblings, their relationships with their parents. It's derailed their emotional and physical health and just their ability to be who wanted to be at this point in their life, right?
Yeah, so, and for what you're doing, it can be tough, with with people at that age, and as what you mentioned, a lot of psychological issues, and you have to be like a counselor. So how do you do it though? Do you have like a big team around you to facilitate all that?
So I've built my team out. We have 18 people that help with pursuing the Care Right mission, which is reaching these families and helping them navigate the healthcare industry, helping them navigate the changing family dynamics. 85% of the clients that come to us, because by the time they find us, they're pretty overwhelmed and burned out. Or by the time they get referred to us, they're pretty overwhelmed and burned out. And so I'm doing family mediation alongside of putting a now crisis plan together for them. But we also do patient advocacy. You would hope that the healthcare workers are properly trained, but in senior care, that's just not always the case. And so we either teach families how to be the bold advocate that they have to be in the healthcare industry, or they hire us to be their parents' advocate to make sure that they're getting their meals, bathed, properly taken care of, that the call light's not taking 2 hours to be answered. And then we also do the grab and go binder, which is it's a plug and play solution to make sure that they have all their documents in order. What are the accounts, the passwords, what insurance policies do you have in place? Who's your financial planner? Who are your doctors? It's really getting all of the paperwork side of things buttoned up for not only mom and dad, but also for the adult kids.
Mm-hmm, mm-hmm. So do you have different facilities around the country, or it's all virtual? How does
it's all virtual. Families just don't live near each other, so like they used to 30 years ago. So when I built Care Right in 2011, I went virtual. Back then we just had Skype. But
yes.
for me to do a consulting, for me to consult with all the siblings and mom and dad who live, 6 different states, I had to go virtual. And so I'm completely virtual, and I'm the only company that I know of that offers this whole concierge package of services. There's companies that do bits and pieces of what we do, but no other company yet that does all of the white glove approach, hold your hand from point A until the end of life, where we do end of life coaching and help the families navigate grief and the changes in roles when the spouse passes away. But we also have the done for you and the done or do it yourself as well. For those families that might not have a budget for the white glove approach, we have the do-it-yourself version that's less expensive. But unfortunately, the reality is oftentimes people don't think to plan ahead. That's why they're always in crisis mode. So if they don't have the intellect or the thought to plan ahead, then they're going to end up in crisis mode, and then the do-it-yourself version of our services isn't going to be appropriate.
And I want to say to you, Annalee, that what you're doing, as what you mentioned, it's unique, and I think it's needed, because the baby boomers, they're old now, right? They need your service, the service that you offer. So it's a booming industry, and with that, I'm telling you, I'm in Georgia, and the senior living facilities, they're popping up left, right, and center.
Yeah.
They're growing so fast, and I can see you can have a great impact. So my question is, do you work closer with these senior living facilities?
So I'm not a placement company. Like you might be thinking of companies that just do placement, where it's just a transaction. They say, hey, I have Ethel who needs to move into assisted living, who wants her, and then they get the kickback. Like that is not my business model at all. These are people and their lives. They're not meant to be bought and sold to the highest bidder.
But I was just thinking, the whole concierge idea, that would be a part of the package where you can recommend them that, maybe later on, this is where that's what I was
so we don't, so we don't recommend any facility. That's why we teach the families how to tour the facilities. What we do is we weed out the facilities or the care communities that are not going to be options for their loved ones. So for example, and this is what we teach our clients, and that's why they can make informed decisions, because you can't just get into whatever care facility you want to because you want to go there. You have to financially qualify. You have to have X amount of years of private pay, or you have to have a certain net worth of assets to be able to financially qualify. So that's why we do that care matrix, to say these are 5 to 8 different facilities that on the surface you would qualify for because you have enough money to get into them. You don't have a diagnosis that would prevent you from moving in. Like some facilities don't want to take Parkinson's patients, for example. If mom and dad things aren't going well at home and they need to move sooner rather than later, then a facility that has a 4-year waiting list isn't going to be appropriate either. So we don't recommend any facility. That's why we teach the families how to do the tour, because it boils down to the tour experience. How well they were treated. Did the residents look happy? Did the place smell good? Were the call lights responded to on the tour? So we teach the families because they're the ones that are going to have to choose either where they live or where their parents live.
Right. And is there at a specific age, like what's your target market or target group? Do you have like a range?
So I get asked that question all the time, like, when is the best time to plan? And I always say, like, right now. And the reason is because everybody needs that grab and go binder, and everybody needs to have an understanding of what the healthcare industry is like. So for example, all the people that woke up last Thursday and had major strokes didn't wake up thinking, oh, I think I'm going to have a major stroke and it's going to derail my finances. And then I realized, oh, I never got my power of attorney documents in place. And, and just like me, I'm 51, but 4 days after my 40th birthday, I was in Sheboygan, Wisconsin, and crossing the street, and a school bus driver was distracted by the kids on the bus, and she blew through the 4-corner stop and she hit me. And she didn't apply the brakes until she saw my face break the headlight of the school bus. But because I do what I do for a living, which is planning, I carry my living will, I carry my healthcare power of attorney, I carry my do not resuscitate, and I carry my list of my doctor and my allergies, right? So when people say, well, when should we plan? Everybody needs to have all of these documents in order. I spent Christmas, 2 weeks over Christmas, with a family who their son was 40 years old, and he was snowmobiling and flipped his snowmobile on his head, and he ended up with massive brain bleeds. And it was touch and go for 2 weeks while I worked with the family, because they were trying to decide if they should basically pull the plug, because he didn't have power of attorney in place. He didn't have a living will. They didn't know what he had for any kind of insurance benefits. So again, that's my point, is now is the time to plan, because we're not promised that things are going to go well today or tomorrow.
Yeah, and that's a great message, because we tend to live in the moment, and as you mentioned with your story, if you plan for that moment, then things could be worse. So that's a good message right there. So you mentioned earlier about international. So you also talk to us about that.
Yeah. So the reality is there are over 300 million family caregivers globally. So all the issues, it's not just a United States or stateside issue where adult kids get thrust into the role of family caregiving, or spouses get thrust into the role of caregiving for a now ill spouse. It's across the globe. And so when I built Care Right, it was in 2011. And so it was right after the economy had really tanked. And I saw a lot of businesses go out of business because they didn't pivot fast enough, or they didn't have a recession-proof business. So when I built Care Right in 2011, I built the most referable business, because everybody knows someone who has aging parents. Mm-hmm. Everyone knows someone who is a caregiver. Everyone knows someone who is in the dementia journey. Everyone needs the grab and go binder, and everyone knows someone who went to the doctor thinking they had a stomach ache or a virus and came out with stomach cancer. And then obviously when COVID hit, that was a really easy you know, opportunity to educate the rest of the world that already didn't have an aging plan, because families couldn't travel to go check in on their parents anymore. They couldn't, necessarily just discharge their parent from the facility, because then they couldn't find home care workers, right? So, and this was internationally. So when the pandemic hit, I already had clients over in the UK, but now I have a whole pocket full of families across the globe, because it's all word of mouth referral. And because like I said, there's 300 million family caregivers. And so thankfully I've built my business off of word of mouth referral, because when you're at lunch break with your colleagues and you're like, oh, thank God for Care Right, because I don't have to keep jumping on a plane every time there's an issue, because we have Care Right's doing care advocacy, care coordination, and they're monitoring things for us. So we can just be the son and the daughter. And that's really what the adult kids want to be.
You're right. Word of mouth is powerful in any business.
Yeah.
And
Yep.
even what you're doing, it's always the best referral when someone, speaks about your service and could refer someone else.
Yep.
But apart from that, you touched on referral. What about your marketing? How do you promote Care Right? Do you do anything online, or what type that strategy?
So we do. We're just actually starting that. We just hired I just hired a marketing company to do digital. Because all of my clients come from word of mouth referrals, but I'm also an international speaker about aging issues, caregiving, dementia, the landscape of healthcare. So I do about 20 speaking engagements per month, whether they are webinars, podcasts, or actual travel to in-person speaking engagements. And then I also wrote my book, The Invisible Patient, the emotional, physical, and financial toll of family caregiving. So between all of the, and plus I've been doing this for 30 years.
You're pretty busy then. That should keep you pretty
yeah, I know, right? Well, I'm an Iowa farm kid. Farm kids were conditioned to work really hard all the time. So it's just like, this is how we were brought up. So yeah. So with the word of mouth referral, like, I just believe that, and I know that if you just do good work, your pricing is fair, and your client sees the value in what you do, they'll spread the word. And so between just doing a good job with clients, my book, speaking engagements, podcasts, webinars, the referrals just continually come in. So
right. I'm glad that you're really putting some spotlight on the digital marketing side, but because that's an area that can definitely ramp up your lead generation and your activities in terms of getting new patients. So good stuff with that. Would love to hear how that's going down the line.
Yeah, me too.
But
it hasn't started yet, so we'll see.
Yeah, but you touched a little bit about pricing. Talk to us about your pricing structure. If someone is listening or watching and they want to say, Annalee, I want my parents to get in this program, how do they start?
Yep.
What's the price?
Yeah, so the first step is really the complimentary, free to them consult, because everybody comes to us in a different place in their journey. Some people are proactive, some people are in crisis, some people just want patient advocacy, some people just want family mediation. So we have such a menu of service offerings. It just depends on what they're looking for, but we have hourly pricing that ranges from $300 to $400 an hour as a normal consultant charges. And it gets more expensive if they're in crisis, or if I have to give up my Saturday because someone's in crisis, I charge obviously more for that. But then we also have aging plan comprehensive packages that can start at $5,000, which when you look at my typical daughters are spending about $15,000 out of pocket just in travel fare every time they have to fly to Arizona. And so I always say, for the price of a couple 3 crisis airfares, you could actually have a plan in place instead of just flying there, band-aiding it until the next crisis. And then grumbling under your breath every time the phone rings because you're like, oh my God, I just got back home and now I have to fly back to Arizona because mom fell again, Right. So you just have to think about, how do you want to spend your energy and your time and your money in a plan, or just band-aiding every single crisis. So it ranges anywhere from 5,000 and up, depending on how complicated, complex, and involved their situation is. But that's why I always say it starts with a 30-minute consult, because sometimes families only need a couple, 3 hours of guidance, and then they can just be an hourly client. But the reality is, aging, dementia, family dynamics are way complicated. So, so there's a lot that we have to kind of hash over. It's not like we're writing out a grocery list,
And I'm telling you, and you want to say that I reviewed your website. You have a comprehensive list of services, and I know if someone is listening and and they want to looking for a service like yours, or have ailing parents, or want to start this process, you're the right person. And I want you to tell our audience, how can they reach you? What's the talk to us about the website and all the methods to reach you.
Yep. So they can actually reach us on the website. We have a calendar on the website. So if they want to schedule their 30-minute consult, the website is carewrightinc.com. So CARERIGHTINC.com. They can also send an email to WeCare. So WeCare@carewrightinc.com. And if they want to just call, we've got the phone number on the website too. So if they go to carewrightinc.com, they'll see the phone number they can call. They can send us an email. They can fill out the contact us card, or they can even just go ahead and schedule their 30-minute consult. And in there's a text box that says, kind of just give us the scoop of what's going on, so that when we have the consult, we already have an idea of what they might be looking for.
Perfect. And you touched on your book and speaking engagement, so they can find that on the website too, correct?
Yeah, and the book is called The Invisible Patient: The Emotional, Financial, and Physical Toll on Family Caregivers. And that you can also buy that on Amazon, or you can go to my book's website, which is invisiblepatientbook.com. I like to route people to the book's website, because unfortunately the downside with Amazon is I have no idea who bought the book. So I can't send you an email and say thank you.
I encounter that issue too. So it's always good to have that book website so you can track, the purchasers. But Annalee, we could go all day. I love what you're doing, and I think your services are really for a good cause, and it's needed in this time. And as what you mentioned, a lot of us, we try to live by the moment, and we don't plan properly. And what you're talking about is really important. So if someone is listening, reach out to Annalee and her team, and they can definitely help you. So any last words?
I don't think so. It's just, I always say, denial, because that's the biggest challenge. Is people are like, oh, nothing's going to happen to me. Or with our parents, they're like, well, I'm going to die at home. They want to age in place at home. But the reality is that rarely happens. That's why when you started talking at the beginning, all these facilities are popping up. That's because it's rare that people can actually age in place at home and die at home, because it's really expensive. So I always say two things: hope is not a plan, and denial is a great place to be until you can't be there anymore.
Yep. Well said. Hope is not a plan. I agree with that. All right. So thank you, Annalee.
Yeah, thank you so much for all you do as well. This was great. I appreciate everything that you do for your customers or your clients too. So it's really important.
Thank you for tuning into the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.